Hello everyone. So with just over a month and a half left for the NEET PG exam, the National Board has thrown another googly. In a recently released circular, what they've said is that the pattern for NEET PG, NEET SS and the fmge exam is going to change now. And what they are going to do is that they are going to have time bound sections. So what they mean with that is that earlier you had 200 questions all together, right? And you could always go back to question number 1, question number 10 or question number 15 and review it before you submitted your exam or the time ran out. But now they have switched to a USMLE type format. What they've done is that there are going to be 5 sets now of 40 questions each. So set A, B, C, D, E, and each set is going to be 42 minutes, right? So once you've submitted or once 42 minutes are done, set A is done, you can't go back to the set A questions, you'll have to move on to set B. So, this change a month and a half before the exam is going to be challenging and tricky. And, there is a huge outcry with students on social media. They're commenting on this. They're saying, why is National Board doing this? Well, all that is not under our control. What is under our control is to adapt to this change. And the one who adapts the best will be the one who succeeds in the exam. Again, I would like to re-emphasize that the course or the syllabus remains the same. The subjects are not changing. The type of questions are not changing. Just the pattern has changed. So what are the challenges? The challenges are going to be time management. Well, I don't think it's going to be a huge challenge, because any which ways you were accustomed to solving a question in 45 to 50 seconds. Here also you're getting a little over 1 minute for each question. If I were you, how I would approach it is that I would like to finish the block in 37 minutes, so that I leave myself 5 minutes at the end to review some of the questions I'm unsure about or I've left in the first go. Okay, so that is what I would do. What I used to do for USMLE when I appeared for USMLE exam was that I used to read the question properly, and you have enough time to do that. I used to see the image or the ECG or the graph which is provided, and then before seeing the options I used to read the last line once more, where I used to see what exactly is the examiner trying to ask, and then I used to read the options and mark them. So this gives you the best chance of answering the question in the first go, and this is what I recommend that you do, because sometimes we miss out on all except or none of the following or all of the following, right? So those kind of things you don't want to miss out in the question. The other challenge is that you can only review the questions of that set in that stipulated time. You can't go back to set A again, you can't go back to set B. So what if you don't have a good set? And that can happen. I remember my step 1 USMLE step 1 exam, my first block wasn't good. So what do? If you carry those emotions or that negativity to the next set, you're bound to spoil your next set as well. So now what you need to practice when you're doing your practice sessions or your custom modules or your mock tests is to let go of that set. You have to reset after every block. So once block A is submitted, reset, start afresh. Stop thinking about what you did in the previous set questions. And trust me, time is going to fly by so quickly that you will not even get time to think about it, but you have to train yourself. Okay, because if somehow that thought creeps into your mind, it will eat away some precious minutes of the next block as well. So what do we do in the next month and a half? First of all, don't change your revision strategy. That should be the same. They've changed the examination pattern, not the subjects, not the syllabus. So stick to your revision strategy. Course remains the same. Try to do 1 to 2 revisions from now till the NEET PG exam. Practice the custom modules with 40 questions. I'm sure all apps are going to make changes and will introduce custom modules which are of 40 questions or tests which are of 40 questions. So practice as many as you can. And the GTs and mocks will also be made with the new pattern, and everyone will make new pattern GTs and mocks. So please attempt at in all platforms so that you get enough practice. So that is what I would do if I were in your place for the next month and a half. And always remember, again, I always re emphasize this point that this change is for everyone, it's not only for you. Now, you can either crib, you can spend time on social media commenting on why a national board is doing it, or you can start adapting yourself. And remember that the more adaptable we are, the more chance we have of getting through the exam. So, all the best. And I know this is a minor speed bump, but if you just maintain your calm, you can get over it comfortably and get a good rank in the exam. All the best.